We begin tonight by looking at the measles outbreak happening in Texas, where one child has now died from it. There's another unrelated outbreak in New Mexico. Thanks for joining us. I'm Derek Dice.
And I'm Kirsten O'Connor. Healthcare experts warn that more cases could pop up across the country. We now know the Texas child was unvaccinated.
I didn't expect to ever take care of measles patients in my career in any meaningful way. It seems like something from the past.
Now, despite the measles vaccine being readily available since the 1960s, we've seen more parents choosing not to get their kids vaccinated. In Spokane County, only 86% of kindergartners received a measles vaccine during the 2023-2024 school year. That's according to the Washington Department of Health. The measles vaccine is one of the M's in the MMR vaccine. The rates are a little bit lower in Idaho, where 79.6% of kids in that age group have been vaccinated, according to the CDC. While those numbers may seem high, the CDC says it's actually lower than the national average of 92.7%.
Madeline Mullins explains why these numbers are declining and why doctors are concerned of a measles outbreak in the inland Northwest.
Vaccination rates are not the only numbers that are changing. Exemption rates across the country for these vaccines are on the rise as well.
Keep our whole population healthy, we need to have a certain high rate of vaccination in order to not have these outbreaks of some of these illnesses we're seeing.
95%. That is the number of people who need to be vaccinated in a community for there to be herd immunity against measles. These numbers fall well below that. In the 2023 to 2024 school year, just above 90% of kindergartners in Washington were up to date on the MMR vaccine, and in Idaho, below 80%. Doctors attribute this in part to an increase in exemption rates. In Idaho, 14.3% of kindergartners are exempt from one or more vaccines, and in Washington, 4.8%. Idaho allows for vaccine exemptions for medical, religious, and personal reasons.
It's always scary when a child dies of a vaccine-preventable illness. And I think there is sometimes a belief that now that we are more mature in technology, we can save kids from anything. And unfortunately, that is just not the case.
Doctors worry that with a growing distrust in vaccines, more and more people will get measles, saying when an unvaccinated child gets measles, it doesn't just impact them, it impacts the other students who are immunocompromised.
So our only way to protect our friends at school who are going through those things is to be vaccinated ourselves so we don't bring it into them.
If you're curious about how your child's school fares and vaccine rates, you can check it out on our website at kxly.com. In studio, I'm Madeline Mullins for News Now.